Today we're going to continue what we started last. We're going to continue on the EHR standards, electronic health record standards. As you will know, as you will see actually, that the things that we're going to talk about are mostly in the United States. All these standards basically started in the United States and basically were globalized after that. So basically the initiation of the EHR technology started in the United States and basically moved all around the world after that. So basically everything started with what's called the HEPA standard, or the HEPA Act, basically, Health Insurance and Accountability Act, HEPA. This is one of the very well-known standards, and basically it was revolutionary. Basically, when it started, it was very much the first of its kind, and it affected everything after it was initiated, actually. So basically, this standard began to establish standards for accountability and criteria for the protection and confidentiality of health information that was transported electronically. So basically, before the HEPA Act or the HEPA standard, some vendors were actually applying certain technologies that are not regulated, and basically they did not have a particular standard to follow, and basically things were not really going very smoothly, basically. So basically some vendors had very good products that had actually accountability for the disclosure of the information, and basically they were protecting the patient confidentiality and privacy and things of that sort, but other vendors did not have that. So basically this particular standard was very important to harmonize everything, to basically put a certain level of standardization among all vendors. So basically it's not up to the vendor to decide which kind of protection that vendor will use. Basically, now there is a standard, and basically it has to fulfill that standard or be above that standard. So basically, this was very important. Then maybe 7 years later, there is another step of what's called Consolidated Health Information, CHI, Consolidated Health Information, which is basically a set of standards that were released in 2003. After that, basically, they started with 5 standards, and then they added another 15. So basically, it was like 20 standards after that. This was very important because basically they started from what HEPA did at the beginning, and they included HEPA, and they added to HEPA a few other standards so that they can further harmonize the way things are done in the EHR, and basically help different agencies and different stakeholders communicate the data effectively. Okay. After that, basically these standards are what's present right now. Basically, you have updates to these standards, but basically every vendor has to abide by these standards as of today. Okay. The point is, when you have a standard, you have to have a neutral agency, or somebody who is a reference or a referee or a judge of how each vendor complies to that standard. Okay, so for example, if you want to have a medical device, if you want to test a medical device for electrical safety, there are testing agencies that you can send your device to, and they will basically test it against a particular standard. And they give you a statement that your device conforms to that standard. We need something like that for the health informatics standards. So basically you have 20 standards, and you have to basically judge any product that is working in this area, in the area of EHR, to be conformant or to be basically up to these standards. So in order to establish that, the Department of Health and Human Services in the United States actually commissioned a non-governmental organization known as Certification Commission for Health Information Technology, CCHIT, to credential EHR programs. So basically, if somebody has a product, if a certain company basically developed a product in the area of EHR, in order for that product to be commercialized and basically to make sure that the potential customers know that this particular product conforms to the CHI standards, they have to go to the CCHIT and basically get a certificate or get their approval on this particular product so that they can basically market it to the customers and basically have the trust basically from the customers in what they say that they do in the conformation or the abiding by the standards. Basically, these are the most significant steps, the HEPA, and then the establishment of the CHI, and then the CCHIT, basically testing products for conformance to the CHI. Basically, these are the most important things. But basically, as you can probably imagine, continuous development in basic, not just in the US, everywhere in the world, people are actually trying to make EHR safer, more usable, more efficient, things of that sort. So basically continuous development basically in this area, whether it is in research or in the market or in the government, basically how the government deals with such things. Basically there is continuous development in this area. So basically we have basically continuous development, but actually we did not see any major steps like the major steps that were listed here. Okay, so basically are just incremental modifications or incremental improvements that are not really do not really amount to a major step. Okay, so basically what we're going to talk about now at the start is about HEPA. HEPA is one of the most important standards, and basically it affected the early development of EHR systems. So basically we need to know the basics of what should be done in such systems. Please stop me and ask me any questions, you know, in the middle of what. If anything you need to ask about, just interrupt me. Don't worry about interrupting me. Interrupt me anytime and ask your questions. So basically, for the HEPA standard, there are 1, 2, 3, 4, 5, 6, 7, 8 different code regulations that are within the HEPA standard. Okay. Each one of them deals with a particular aspect of the privacy, the security, of the protection of patient information, things of that sort. So basically it starts with very simple things as password management. Password management, I think if you imagine that you're talking about this in 1996, probably none of us actually worried about passwords at that time. Basically computers were not as connected to the internet as we have now. And basically, nobody worried about the password, but as much as we do worry now. But at that time, regulating how passwords are used was very important. For example, some EHR systems had what's called default passwords. Default password means that if you buy a certain product, EHR product, basically there is an administrator password, and basically when you receive that product there is a default password for the administrator. So basically you can change it and make it whatever you want, but the problem is having a default password is a problem in itself. Why? Because sometimes when this system is received by a hospital with no IT staff, basically they keep the password as it is. They think that this password is good enough and that's it. You just keep it. So basically, if a hacker wants to attack this particular system, if he wants to attack the EHR of a particular hospital, he would try the default password first, and then if it doesn't work, he will try other things. But basically, if the default password was never changed, then he would gain access and do whatever he wants. He can get the information he wants because he would be like an administrator for this particular system. So basically, this was a very dangerous thing that had to be eliminated. So in the HEPA standard, they mandated that no default passwords are assigned to EHR systems. In addition to that, as we're going to see, we have so many different users for EHR systems. whether it is the doctors, the administrators, the nursing staff, maybe some patients also would like to, have access to their electronic records for basically if they have a remote consultation visit or something like that. So basically, so many different users for EHR systems. It's very important to make sure that the passwords are strong enough so that any hacking that would attempt to basically guess the passwords or basically use old passwords so that some of them may be used on different systems. So basically, whenever, for example, a hack happens to Yahoo or Google or whatever, the attackers would gain access to so many different passwords. So basically, if you're using the same password on different places, then basically if the hacker has a database of passwords, he can try this database, and some of the accounts would actually open with these passwords. So basically, for the password management, they mandated a certain length for the passwords. They mandated that it would contain, they recommended basically that it contains letters, numbers, and special characters. They actually recommended also that it is changed every 90 to 120 days. So basically, it should be updated or changed frequently, so that basically, if somebody's trying to guess the password, you would basically reset that process every 3 to 4 months. So basically, some regulations regarding the password management were introduced in the HEPA standard. So basically, this is one of the simplest and the most effective security measures that anybody can take actually in a system like this, and in general. The other thing is having a unique user identification. So, for example, if you have a hospital with many nurses, it's not enough to have an account called nurse or an account called doctor. It doesn't make sense to have it like that. The problem with that approach is that it might be simpler, and basically you don't have to worry about having so many different accounts. But the problem is whenever you access the patient information, you need to account for who is accessing that information. Whenever you change that information, you need to make sure who exactly did that. Okay, so it's not enough to have just a nurse or just doctor. You have to have unique user identification. So for nurse, you have to have exactly, for each nurse, you have to have an account for her. Okay, for each doctor, you have to have also a different account for different doctors. Okay, so that whenever any of them tries to access the system, basically you have to make sure to log who did that, basically who read that information and when, and who made the changes, things of that sort. Okay, so unique user identification is very important. So basically here, you're adding a username which is unique to each user. Okay, very much like what you have right now at the university. You have a unique username. Your username is not shared by all the students in the graduate studies at the biomedical engineering department, for example. You have a unique username. So basically, if any violation basically was done from your account, you are responsible for that. Okay, so this is very important. The other thing that is related to unique user identification is what's called access authorization. Access authorization is different from the above two. Maybe when you think about access authorization, you might think that if I have a unique user identification and I have a strong password, then this is the authorization I need to access the system. Actually, it's not like that. Access authorization means that you, for each user level, you give that user access to the minimal information that he needs to do his job. For example, for a nurse who is working to schedule the patients, just schedule the appointments of patients with doctors, that particular nurse doesn't need to look at the medical information of the patient. Basically, she doesn't need to know about the allergies of the patient. So basically, all she needs to know is the kind of examination and basically the availability of the patient to have that examination, and that's it. So that physician can schedule the proper examination, and that's it. For a doctor, for example, no, he needs to know all the information, of course. He needs to access all the patient file. And also, for some doctors, also you have to have levels, different levels. For example, if you're talking about a doctor who is just like a general practitioner, he might have an access authorization level that is different from a specialist, that is different from like a head of the department, for example, okay? So basically, you have to have access levels, you have to have levels of access, and this levels of access would ensure that basically each one of the hospital staff or the healthcare staff would access enough information to basically do his job or her job, but actually such information basically is not beyond it. Basically, you just access the minimal information, not all the information. Okay, so basic access authorization is very important, because basically otherwise it's like basically you have access. Basically, if a security guard has access to the system for some reason, okay, he can access all the data and can modify all the data and things of that sort, and this doesn't make sense. So the people who can read the information have different levels. The people who have authorization to modify the information have higher access levels. The people who can delete and add patients might also have an even higher access levels. So basically, such levels of access are very important to make sure that the information is not disclosed to somebody who is not basically involved or doesn't need it, basically. Okay? So this is a part of the accountability and part of the protecting the privacy of the patient information. Related to all these things, you have to have accounting of disclosures of protected health information. This is a very important term. You will hear it a lot actually in medical informatics, protected health information. Protected health information is basically your record, your medical record, okay? This is private to you, and basically only you can authorize others to basically look at it or change it or do whatever you want with it, basically, okay? So basically, when you talk about protected health information, only doctors should be able to access such information, and only when they need it, not just all the time, basically. So you need to account for the disclosures of such information. Disclosures means that somebody actually looked up that patient and read that chart, for example. If somebody looks a patient from the EHR, from the database, and takes a look at his ECG, for example, or his sonogram, or his X-ray, chest X-ray image, or whatever, this is disclosure of information. Somebody accessed that information, okay? So whether it's authorized or not, you have to actually have accounting of such disclosures. So basically, each access process or each access operation to the EHR database should be basically logged, should be monitored. And basically, if you want to know who looked up this information for a patient, you can actually know that. You should know who exactly accessed that information and when, okay? And you should be able to match that with the login records so that you can basically know that this user logged in from this place and logged out from that place, and basically in the middle, that user looked at certain records and things of that sort. This is very important because if for any reason there is a leakage of such information, you need to know exactly who was responsible for that leakage, which is really important. Okay, so you have to have very strong auditing, or very strong basically authorized accounting of who did what on the system. This is extremely important. The next thing is security and data backup and storage. This is extremely important because this is related to the trusts of users in the system. Basically, you have to make sure that you have a complete copy of whatever you have on the EHR somewhere else. so that if for any reason somebody deleted something by mistake, if the server had a problem or whatever, you have access to a complete record without any missing information. So this is extremely important. Security, of course, meaning that such information should be placed somewhere and should be encrypted, and it shouldn't really be accessible to anybody. For example, imagine that I'm storing the EHR information on a particular hard drive. I have a hard disk and I put everything on that hard disk, okay? Imagine that, we're going to talk about that later on the cybersecurity. One of the most important things that could basically compromise security is physical access. Physical access meaning that somebody sneaks into the server room and opens the computer case, and basically steals the hard disk and goes away with that hard disk. Okay, if I have that hard drive, can I access the information? If the information is not encrypted, yes, he can do that. Okay, so basically it's very important when you store information on a certain drive, you should actually make sure that it is encrypted in a way that doesn't allow somebody with physical access to that drive to basically access the information. Okay, or basically access whatever is stored on that hard drive. Data backup is very important because, as I said, basically accidents happens. Maybe there is a fire somewhere in the server room, or maybe there is a physical failure in the drive, things of that sort. These things happen all the time. So basically, you have to choose your options so that you don't lose any information because of such problems. The kind of storage you will use, we'll discuss that later, particularly for PACS, because PACS is probably the component of the health informatics that would use the most storage, because usually the data sets from imaging are the largest data sets. So basically, we're going to discuss some options about the storage that should be used there, like RAIDs, a redundant array of independent drives, or maybe there are several options actually that we need to discuss, and among them using cloud storage. And basically, you will have different advantages and disadvantages of having your own data center at the hospital or having a data center in the cloud. And basically, you have to basically study your particular situation and basically decide based on your unique characteristics of what your system will use and basically would need during the operation. So basically, there are several options for storage, but actually there are requirements that would make sure that such storage is safe and basically is accessible. Basically, there's a minimum uptime. You basically don't have time where you don't have access to the data, because sometimes if somebody is going to surgery and you need certain information, you don't have to wait for hours, for example, to get that information. So this is really important. The next thing is the auditing abilities. Auditing abilities actually is related to all the above, basically. You need to have auditing of everything that happens on the system, basically. You need auditing means that somebody can come and tell you, please give me the record of all the passwords that were changed in the last month. Okay, you should have that information. You need to have a record of who accessed what. If there's a piece of information, you need to know exactly who accessed that piece of information during the last week. You should be able to, the EHR system should be able to basically give you that information. Auditing means that inspection, basically somebody, a reference or an external agency or regulatory agency comes and basically test your system to make sure that it conforms to the standards. So basically should be able to have all the information about how the system was used, maybe forever, maybe since it started. Okay, so you have to have the who accessed what, who actually the logins that happen. You have to actually have a record of all the logins, all the user logins to the system, and basically choose one of the users and check what that user did, and make sure that this user, if that user is a nurse, for example, the user is accessing only the information that is related to his job, not any other information. He's not allowed to access any other information, things of that sort. So auditing is extremely important. And basically, this is what makes this system actually very powerful, because it has accountability. You actually, if something wrong happens, you can have somebody accountable for whatever happened. Okay, it's not going to be a problem of the system. It's going to be a problem of the user who did that wrongdoing, basically. The next is what's called code sets. Code sets is a little bit strange, or a little bit unusual for us here, but it's very important. If you go to a doctor, maybe in Saudi Arabia, and basically have a certain disease, okay, he might tell you that this disease is called X. If you go to another doctor, maybe some other region in Saudi Arabia also, he might tell you that this disease is called Y. If that doctor actually advised that patient to have a certain operation, he might tell you that you need an operation called ABC. And the same operation here is called CDE, for example, okay? So basically, usually, at least, in the medical community, some things are not standardized. So basically, the naming of the diseases, the naming of the operations, sometimes the medications, the names of the medications, things of that sort, might actually have very wide range of variation. And this is not acceptable, basically, because what you're trying to do here is a record that is not made for somebody in particular. It's made for everybody to read. So basically, it's very important to standardize the names of the diseases, the names of the surgical operations, the names of the medications, the drugs that are used. All these kinds of things are called code sets. Code sets, you have a certain code for each disease, you have a certain code for each operation, and this is extremely important, because once we agreed on the code, basically it's exactly the same everywhere. Okay, you don't have to call the doctor and ask him, what do you mean by this? Okay, do you mean this or that? It's not like that now. Okay, so basically this code set is comprehensive, and it allows the terminology used in the EHR to be very much universal, and basically avoid confusion. And of course, if you have confusion, then you might have medical errors because of that, and basically you want to avoid all of that. So there are certain code sets that were basically suggested or basically used in that part, and this was actually a very important step, because actually if you imagine that this will be used also by the medical insurance company, then you would imagine that this is really important, because the medical insurance companies will have certain amounts of money to pay for each one of the operations, for example. Okay, if the operation is not clear, then the medical insurance company might pay much less than the actual cost of the operation. And basically, they say that this is what we have. Okay, but if you all agree about that operation is that code, then there is no way that this would happen actually, because it's universal and everybody knows what it is exactly. The last thing is what's called Health Information Technology for Economic and Clinical Health, the HITECH Act. This is actually meant to allow different agencies to basically start communicating the information. This is probably not very important to us here, because it's meant for the US government agencies, and basically the other things are the most important. So basically, just forget about this one here and just focus on the first few things, the first 7 things. Okay, these are extremely important. One very important question before we move on to the next standards, basically, is this HEPA standard still in operation right now? Actually, yes. And basically, you're going to see it here. Basically, the CHI standards is what is introduced in about 2003. And basically, I said they started with 5 standards, and then they added about 15 other standards. Among them are these standards right there. Among them actually are the HEPA standards. So the HEPA standards are among the CHI standards. So basically, it's still there. It's still applicable. It's still very important. Okay. So HEPA standards are not obsolete. Okay. So you need to understand that. So the other sets of standards, actually, they say that the HEPA standards focused on very important aspects, but they did not cover all the aspects that are needed for EHR. So basically, there are other standards that are actually added to the HEPA standards that would include things like HL7, the health level 7, basically. HL7 is the communication language between different systems. So for example, if you have a certain medical device and you have an EHR system, okay, you need to access that medical device to gain the information, to get the patient information and store it in EHR. How would you do that? Okay, if you imagine that you're going to do that, then you're probably thinking about a custom interface, and you write your own code, you write your own instructions, and basically, if you do that this way, then somebody else will do it in another way, and somebody else will do it in a third way, and so on. So health layer 7 actually is meant as a universal communication language between different systems that would promote interoperability. Interoperability basically is the most important term for basically for this particular part. Basically, it's all the standards aim to have interoperability. If you have a system developed by vendor A and another system developed by vendor B, then they would be able to communicate information using such standards. Okay, HL7 is the way to communicate information between different health informatics systems and between health informatics systems and the medical devices. Okay, so this is very important. Okay, one of the other standards, this will probably take some of our time in PACS. Basically, we're going to discuss it a little bit more, and also health layer 7, we're going to discuss it a little bit more detailed later on. There's a chapter called standards, so basically we'll discuss these particular standards in particular because they are very important. This DICOM standard is very important for medical images. So imagine that the type of general images that you have JPEG, you have PNG, you have PMP, you have so many different kinds of images, basically. The problem of using such images, such formats in medical images is that for each one of the modalities, you have a different format or a different resolution for the images. Not just the resolution of, for example, number of pixels by number of pixels, like 1000 by 1000. No, it's also related to each pixel. How many bits do you have in each pixel? Some modalities have 8 bits, some modalities have 16 bits, some modalities have digital, complex numbers. Okay, like for example, MRI, for example. Okay, so basically you have very, very wide variations in different image types, in different imaging modalities. Another thing is, if you have a certain image, if you have a certain patient, and basically this patient went and did a certain imaging study somewhere, is it enough to just have the images? Usually it is not, because you need to know exactly what imaging modality was used, what are the settings in this imaging modality. So basically, if you have different settings, you need to know that. You need to have, preferably, you need to have the report of the doctor about this, basically included with the images. So basically, DICOM format is not just an image format. It's a data format. So you have the essential information about the images, but in addition to that, you have what's called meta information. Okay, you know the word meta. Okay, of course you know that because of the change of Facebook to Meta, but metadata means that data beyond the usual data that you would expect from an image. So you have data about the modality, the system that you used. You have about the settings. You have basically the positioning of the patient within the imaging modality, for example. You have the if you have any comments from the doctor, and so on and so forth. So basically, if you have such information, you have a lot of things to basically make sure that whenever you have this data, whenever you have this data in the DICOM format, you have enough information for the doctor who is going to read them in order to make a diagnosis. Okay, he doesn't have to go and ask the doctor who did the radiology scan to understand what happened. He doesn't have to do that. Okay, it's all in the DICOM format. We're going to try that. I'm going to give you some example DICOM images, and you're going to be surprised by the amount of information that is included there. Okay. There are other things related to, for example, prescription drug programs. Basically, there is a drug database that has the drug interactions, so that when you prescribe a certain drug, you make sure that it doesn't have a conflict with an existing drug that the patient is using. Things of related to the lab results, for example. So basically, when you have a lab results, as you know, if you read the lab results before, you will see that, for example, you just write CPC, they're like things of that sort. Everything is like abbreviations. These abbreviations have to be standardized with such a standard so that the lab results from anywhere in the world would be the same, would be readable by any doctor in the world. Okay. Same thing as the nomenclature of medicine clinical terms. For example, if somebody is using a certain medical term for the treatment or the diagnosis of a patient, it should be the same. Okay, so this is very important. Okay, this is code sets are actually related to that, but they're not exactly. They are a little bit different. And also now we have genetic therapy or things of that sort. You have to have also human gene nomenclature. So basically, this is important to standardize the terminology used in gene therapy, for example. So basically, you have 20 standards, and these 20 standards actually cover so many different aspects of the EHR, so that if you conform to these standards, you have a very good likelihood to have interoperability with any other system. So this is extremely important. So basically, maybe before we get to that, maybe you can talk about this first. Basically, the CCHIT is Basic Certification Commission for Health Information Technology. Is basically this is the agency that would test any particular solution or any particular product to ensure that it conforms to CHI standards. Okay, so the mission of this certification commission is to accelerate the adoption of health information technology by creating an efficient, credible, and sustainable product certification program. So basically, they are product certification. They're aiming to have a product certification so that when a customer, when a hospital, for example, wants to buy a health information technology product, and this product has certification from CCHIT, then it would actually give confidence to that hospital that this product would actually work well without any problems. So this is very important, okay? As you remember from last time, a part of the problem in the early adoption, or basically the delay in the early adoption of EHR was because the lack of standardization. So now this certification commission aims to basically make sure that all the products in the market are standardized. So basically, people would have confidence in them. So basically, it brings an official recognition and approval requested from both private sector and government. Okay, this is very important because basically, if you go into a private hospital or a government hospital, you need certification. You need to have to make sure that this product actually does what it says it does. And such industry standard-based criteria for EHR will promote their use and confidence in their use. So basically, promotion of their use and confidence basically related to how they are certified is very important to promote or basically boost the distribution of EHR solutions. So if you have CCHIT certification, it means that the product has met 3 basic requirements. First of all, functionality. ability to carry out the specific task that it say it does. So basically, if this product says that it does 1, 2, 3, then actually, if it's certified, then you are sure that it does that. Interoperability, which is extremely important, compatibility and communication with other products. Security, meaning that it's able to keep the patient's information safe. Okay, so these three aspects are very important. And the EHR vendors are required to display the term CCHIT certified and the year of certification when marketing their software. So basically for the vendors to basically give the potential customers assurance that their product is safe or basically conforms to these three basic requirements, it has to have this CCHIT certification. And basically you have to put the year also so that people would know how long it was certified, how long it has been certified, so that this actually can give an additional dimension of confidence to the customers. So now if I want to basically discuss the core functions of EHR, if you go to the Institute of Medicine, which is basically the first organization that recognized the need for EHR, right now it has identified a certain list of core functions for EHR that basically they are not required, they are not standard, they are not certified by anybody, but actually they recommend for any EHR solution to have these functionalities. Okay, so basically are guidelines for key capabilities and functions that should exist in a quality EHR program. Okay, should exist, meaning that it's very much recommended, but it's not required. Okay, so the first thing is health information and data. Complete patient data must be present. This is very clear, actually. By the way, some of these functions are actually, or some of these things might be actually required by the standard, but actually what they did was to put the list from their point of view without even comparing them to the standard. So basically, for the complete patient data must be present. This is very important, but in some standards, actually, this is a must. Patient support, home monitoring of patient education, and telehealth. Home monitoring of patient, meaning that the EHR solution should allow for patients to update their measurements, for example. If a diabetic patient is taking his own basic glucose measurements, for example, at home, he should be able to log in to his EHR and update the measurements whenever he does that. If he's measuring his blood pressure, he can also do that. This is very much recommended. This is very important because when he goes to the doctor for his checkup or for his regular visit, the doctor can actually watch his or display his curve, the curve of his measurements, so that he can identify any unusual readings, so that he can actually deal with them very quickly, okay, without having to wait until a problem happens. Patient education means that it should actually give the patient information about certain things to do. For example, if that patient is taking a certain medicine, okay, and basically his measurements were not as good. So basically the system will display some messages to guide the patient on what to do in order for him to have better readings, for example. If the glucose level is a little bit high, then he might give also some points for the patient in order to improve the outcome of his glucose measurements. Okay, things of that sort. It should also allow for telehealth. Telehealth means that the patient can take some measurements and basically can consult the doctor from his home. He doesn't have to go to the hospital, for example. This is very important now. Of course, all of us now realize that this is extremely important because of the COVID-19 lockdown, and basically people were not able to go anywhere, basically. And actually, among all places, actually hospitals are the most dangerous for anybody, okay? So some of the elderly, for example, stopped going to the hospital, and this was a problem. This was actually, nobody was able to consult with their doctors, basically. And this was a problem. So telehealth is a very important feature of EHR. So basically, the patient can update his readings, and at the same time, he can send his data, or his doctor can actually look at his record and basically can prescribe things for him without actually having to go to the patient or the patient go to him. Results management. Management and ordering of lab test results and radiology results. So basically, whenever you have a certain patient doing certain tests, okay, it would actually allow the EHR should be able to take the results of these tests and arrange it in a way that would be suitable for a doctor to look up, okay? So basically, if the doctor looks up a certain patient, he should be able to see like a report about the recent examinations or recent tests of that patient in an ordered manner so that he can actually get to the diagnostic process as soon as possible. It should also have such things as administrative processes like scheduling of appointments with doctors, billing, like if you have certain subscription with healthcare management or health insurance company, basically it arranges for that. Some people actually pay a part of their bill, so that the health insurance doesn't cover everything, but they basically have to pay a certain amount or certain percentage or a certain premium for whatever they are doing. So basically it should allow for that billing to happen through the EHR. So basically he can pay, for example, whatever he owes to the hospital through the EHR. Medical claims, for example, if he had an accident and basically he was not able to provide the proof of insurance during that accident and he had to pay for the hospital costs, he can actually file a claim so that his insurance company can pay for whatever it should pay for. Things of that sort. So basically, it should also allow for like such thing, authorization referrals, like for when doctors, for example, as a general practitioner, basically can refer the patient to a specialized doctor if he suspects something is wrong with a particular problem with that patient. So administrative processes should actually be done through HR also. You should be able also to do order entry and management, okay? For example, orders means that the doctors can basically order certain operations or certain examination for the patient. And prescriptions, that the doctor can also put a prescription or add a certain prescription, certain drugs to that patient, or modify them. If he's taking the drugs every month, for example, like diabetes, he can actually modify a certain drug to be another one, for example, a better one. Okay, should be able to do that. And the other things which is really important, I think probably we see that now in Saudi Arabia with COVID-19, you have reporting and population health. Now you can get information, basically, if you go to the Ministry of Health website, you have a dashboard that would tell you how many people were diagnosed with COVID-19 today, for example, yesterday, okay? How many people are in intensive care because of COVID-19, okay? How would you get that information? This is actually a part of EHR, basically. If you have EHR in all the hospitals and they are all connected, then you can actually report the things that are related to population health to government agencies so that they can actually do the public health statistics, and basically sometimes they actually decide on policies, what to do, things of that sort. For example, at the beginning of the COVID-19 epidemic, basically, there were people getting infected, but actually at a certain time, the government decided to have a lockdown. How did they decide that? They decided that based on the population health information that they got from the hospital. And this is very important, okay? The next things actually, maybe this one at least, it's kind of futuristic a little bit, okay? Medical decision support. It's debatable. It has a lot of things that, a lot of details at least. Can you have a system, an electronic system that would aid in medical decision, okay, making medical decisions, okay, like drug prescribing and dosage, disease screening, diagnosis, treatment, care, quality improvement. Like, for example, everybody talks about AI right now. Can we have a system like this? Basically, you have a provision for having a system like this. But this is actually a very sensitive topic, because basically, if you talk to doctors about this, you would feel that you want to replace them with an AI system. And this would never happen, basically. At least it's not going to happen in the near future. At least it's very difficult to happen because of a lot of things. Among those things is that if you even have an AI system that would allow you to diagnose certain diseases, if you are the owner of the company that makes that software, would you be able to handle the malpractice problems that would happen if, for example, if you make a mistake, if your system makes a mistake, okay, would you be able, or would you accept to be liable to the lawsuits or the whatever, if the patient had a problem because of that, and basically takes you to court and basically asks you for millions of whatever reals or dollars or whatever because of the error that happened? Would you be able to pay for that? Actually, it doesn't make sense. As of now, the liability lies on the doctor and the hospital. Okay, so basically, you can have systems that would be called support. Support means that it gives the doctor some idea, or basically gives a second opinion to the doctor. But it's the responsibility of the doctor to make the decision, and he's going to be liable for that decision. If he makes a mistake, then the patient could sue the doctor and the hospital and get money out of them. That's why all doctors here, at least in Saudi Arabia and the US and all these places, you have to have insurance. You have to have malpractice insurance, so that if you have a claim like this, you not have to go broke or basically spend all your money to pay for a mistake that you made, because basically everybody can make mistakes. So the insurance would pay that much money for you, okay? So basically having medical decision support is kind of a debatable item. It's not really there yet. It's not very clear, the boundaries of that kind of support, but actually it should be a provision for the future. The last two things actually are very important, which is electronic communication and connectivity. This is very important, because basically you need to be able to access information between specialists, primary care physicians, radiology, labs, and so on and so forth. So basic pharmacies is here. I'm sorry, it's correctly here. So basically, whatever you have for a certain patient should be able to access the information related to everything related to that patient, okay? So electronic communication connectivity, for example, if you're prescribing certain disease or certain prescriptions or certain drugs for a patient, this information should go directly to the pharmacy, so that when he goes to the pharmacy, he would find it in his record and basically just get his medications and go home, and that's it. He doesn't have to get a piece of paper with the list of drugs from the doctor, basically, okay? Same thing for radiology, for the lab, things of that sort. So basically the information is available to everybody, and basically it's the connectivity and how the communication happens. And for example, when the doctor asks for a certain lab results, basically, or certain lab tests, basically it will be ordered directly from the lab. So the patient goes there and finds the request already there, and basically does the lab test. And whenever he's done, the results go directly to the doctor without having to take them physically back to the doctor. So these are very important things. So consider these as the ideal characteristics of an EHR, okay? How far are we from these? Actually, with the exception of the medical decision support, there are systems right now that are very close to having all these things, okay? Maybe 10, 15 years ago, this wasn't as close, but now basically most systems actually have most of these functions completely there. Even for the part at the beginning here with complete patient data being present, some systems actually go as far as taking the hard copy patient file and convert everything to digital form and basically having all that available on the electronic system. So basically, it's not like we're going to start from now. No, they go back and basically digitize all the old information so that basically whenever they have a patient on the record, they have everything from whatever he did before and basically have everything accessible in a digital format. Okay, so basically this is basically what the Institute of Medicine recommended. These are recommendations, they are not requirements. The requirements are the standards, which right now are the CCHI standards. We need to remember that the HEPA standard is a part of the CCHI standards, and basically it's not obsolete, because this is one of the questions that you're going to be asked about. And you need to understand what the HEPA in particular does, because very much this is the most important, by far, this is the most important standard in the field of health informatics. So you have now a homework, okay, and basically you have more than a week to finish it. I think it's about a week, okay, from today to finish it. The homework is very simple. It's multiple choice questions and true false. It's basically you have an open book. It's an open book assignment. So basically you can go and read the textbook, read the lecture, whatever. And basically I hope you'll be able to solve everything correctly. The project, I heard some complaints about the how it's gonna be. Let me show you exactly what I have in the project. I'll just close this and open another window. So basically, I'm not sure if you see it. Can you see the, yeah, okay. So basically, this is a chapter of the textbook that I was talking about. Basically, there is a software, of course, I told you about last time. I'm going to show it to you quickly right now, but let me just discuss the project first. In this particular project, what I need you to do is to implement the exercises that are present in this particular chapter. This chapter is very interesting because it shows you how to do things that are very important in an EHR system. For example, perform a drug allergy check, for example. Understand the purpose, not this one, the how to insert a document into the patient's chart. So basically, this particular chapter, all the chapters of this textbook actually are based on the software, okay? The demo software I was telling you about last time. And basically, it tells you exactly how to do things. And at the end, you will have like an exercise like this. And basically, the exercise is like as if you're reading the manual of a software. It tells you exactly the steps. And basically, if you want to create and conduct a chart evaluation, for example, you need to follow these steps. And basically, at the end, you'll be done. You get exactly the same things that you would see here in that relevant part. Basically, some people complain that this is too long. Okay, that's fine. Okay, do the best you can. Basically, I don't expect you to spend more than 1 day working on this project, and I'll accept whatever you have. If you do 50% of these tasks, I'll be satisfied. Okay, just show me that you opened the software and played with such things and tried things, and this should be enough. The reporting of this,
Doctor, do you have to do all the steps in each exercise and then take a photo, or we take a photo for each step?
No, just whatever. Okay, you can choose whatever you want. Okay, you don't have to have all the steps, of course, because this will be a little bit too long. Okay, so basically, just choose the conclusion or the most important screenshot for each one of the tasks and just put it in the report. This is what I was saying right now. The report is not you don't have to write anything. Okay, so for example, you're going to say that for exercise 7.3, basically, I'm going to have something like this, for example. Okay, just take a screenshot like this and put it in the report, and that's it. Okay, just show me that you actually did that. Okay, all I want you to do from this project, the outcome of this project, the intended learning outcome of this project is for you to get familiarized with the software. Okay, how you operate the software, because actually it's a very nice software actually, and it will give you an idea about basically how EHRs work. Okay, so basically let's agree that you're going to work maybe for each one of these tasks maybe 10 minutes, okay, 10-15 minutes, okay, and that's it. Okay, not more than that. Okay, for each one of these. So you have maybe 80 minutes. Okay, 90 minutes, maybe an hour and a half, something like that. If you spend more than 2 hours, then it will be a little bit too long. Okay, do we agree on that? Okay, so this project should take maybe the maximum 2 hours. Okay, and whatever you have, I'll accept it. Okay, just show me that you actually tried that. What I'm going to do right now is I'm going to show you the software itself. Okay, so maybe I'll share the screen then, so that it. I'm not sure it's working. Okay, now it's working. So basically, I'll take. Okay. Basically, I have the software right here. Basically, this is the icon for that software. Can you see it? I'm just gonna click on it.
Yes.
Basically, can you see it now? You don't have to see the details because you're going to do that yourself. Okay. Okay. So basically, I'm just going to show you exactly what you're going to see actually in this software. So basically, maybe I can just start with the file cabinet. File cabinet has all the files, basically. And basically, there are so many different, basically you have about 2 patients there so that you can look at them. So basically, I'm going to just search for whatever is there. Maybe I'll just see the ECG here, for example. I can see the document. See here, there is a PDF document here. So basically, this is a document for a particular patient. You can actually look at other things. Maybe I can just look at an image, MRI brain. Okay, here. See here, there's an image now. Okay. So basically, there are different formats that are present there. You'll find reports that are written in Word. You'll find Excel sheets. You will find lab reports, things of that sort. So basically, let me just get this here and get the chart for this patient. This is the patient, basically. And basically, if you want to get the chart for this patient for any other things like the file cabinet of this patient, you can find a lot of things. For example, let's just close this. Maybe I can get the lab results, for example, for that patient. Test image. Okay. CT scan. These are imaging all. Okay. Get chart. Okay. Here, for example, you have the medications that this patient is taking. Okay. Here, you have the for example, the tests that are assigned but they are not done. For example, you have the if you go to here, for example, you can look for things. Look the chart, search the chart for diagnosis. For example, lab only. For example, they couldn't find anything here, but can test. Maybe I can find prescriptions. Find. Actually, I can't find anything here. Maybe the results are not here, but there's a file cabinet here. You can find here the results from this patient that are present. Maybe here. Here you find the immunotherapy results. Here, you see here it's an Excel sheet. It has the information. So basically, you have a collection of different file types for each patient, and they are all in one place. So the doctor can actually look at these results, can see the patient information, He can see all the medication that this patient is taking. He can see all the allergies of this patient so that he can take care of such allergies when prescribing drugs. He can actually basically see whatever tests that are due for this patient. Everything you find there. So basically, this is extremely important and extremely nice. Actually, if you try this yourself, you basically open this and try to play with the information and see how much information is there in a very small place. Basically, you can have all the patient, you have all the data for all the patient this way, so that you're missing nothing basically. So the goal of the project is to give you the practical hands-on experience with such system. It's very nice to have a system like this to work with, and it's actually, you might think that it's not as big as the other system, but actually it is very much, if you think about all the things that we talked about, you can here schedule appointments, you can actually manage the information of the patient, you have all the information from before, and obviously, if you look at, if you remember how the ECG looked like, basically, for example, here, the ECG, it's a scan here. It's not electronic form, basically. So basically, everything was converted to electronic form. So basically, this is very much a functional EHR system. Is it a product that is available right now? It's probably not. I'm not sure if it's available or not, but actually it's a very good example to give you a good idea of how EHRs work and how they look like, okay? So basically what I would like you to do is try to do the homework, try to start on the project, and if you have any problems, inshallah, on Tuesday, you can ask me questions, any questions you want, I will answer, okay? And if you have any issues related to, you know, how difficult the project is or whatever, we can discuss them on Tuesday, inshallah. Okay? Tuesday, inshallah, we're going to start a new topic. But actually, we're not going to start a new topic before answering any questions you might have for the first part related to EHR. Okay? Do you have any questions?
شكرا.
So, Mahmoud, you have any? Mahmoud is still worried? Mahmoud?
Doctor, I sent the project for you. Did you get it or not?
No. When did you send it?
Today in the morning.
No. Did you send it to? Where did you send it? Basically, I didn't see it.
Okay, I will resend on your email. Okay, because I sent.
You already did the project?
Yes.
Okay, great. So basically, so it's too easy then. Maybe you can add another chapter then.
Not easy, okay. Hard, doctor.
So your colleague is suggesting to have another chapter in addition to chapter 7. Would that be okay? Would that what you asked for? Or, so we do chapters 7 and 8 now. Okay. Okay, that's fine. That's fine.
صلي على محمد لو ورطنا.
خير إن شاء الله. Okay. So if you have any question, let me know. For Reno, because I know that you're traveling at the end of this week, if you are busy, you basically don't worry about the deadlines. Okay, you can submit a little bit late, no problem about that. Okay.
Doctor, regarding the installation of the program,
yes.
The installation is okay for me, but I have some problems regarding Java. Since if I open the link, it says in the link, check, do I have Java? There is no icons named as do I have Java.
Don't worry about it. Don't worry about it. As long as it works, it's fine. Okay.
But the problem is it's not working because it says you need the Java. Yes, you need the Java or JER. Okay. I downloaded the Java, even though it's not working, the same message come to me. So can I screenshot make a screenshot and send it to your email so
sure,
you
no
can
problem.
advise me?
I think the best way is probably I think I installed it like a year ago, okay? I think some of your colleagues already did the installation recently. I think, for example, Mahmoud told me that he had to install the Java first. So he might give you, if you can,
yes,
if you can send the information to your colleague, that would be better. I think you have a group for, You have a group for,
Yes,
for this course, right? You have a WhatsApp group.
Yes.
So probably it's better because actually the links that I used might be different from the current links. Sometimes when you install the Java, sometimes the things change a little bit. So I would suggest to try your colleagues first. So whoever, I think there are at least 2 who already installed the program recently, like in the past week or so. So they can send whatever they did to everybody. And if you still have a problem, please let me know. Okay, please send me the screenshots and I will see exactly what the problem might be. Okay?
Okay, shukran.
Okay. Don't worry, inshallah, it's not going to be a problem. Don't worry, inshallah, it's going to be simple. Okay? So any questions? So we're done for this lecture. Inshallah, next time we're going to start on another topic. Okay? Inshallah. I'm still thinking about what to start with. The usual thing, basically the sequence of the course is a little bit different. Basically, the next topic should be HIS, and then PACS, and then teleradiology, and then standards, and then we talk about the cybersecurity, and then talk about networking. Okay. But actually, from my experience with undergraduates, they actually like the part about the cybersecurity, basically. So it's very much very important information that can apply everywhere, not just for medical informatics. So basically, we're going to go through it first, probably. So next time we're just going to start with cybersecurity, and then maybe we just take the networking. I think we have a few people from the computer engineering that might find that too easy for them, but for most biomedical engineers, they are not familiar with how networking works. So basically going to go through that. And then the rest of the items will be HIS, and then HIS including RIS and things of that sort. And then we're going to talk about PACS and basically finish the course with the standards. Okay, so next time, inshallah, we're going to start on cybersecurity, inshallah. Okay.
Doctors, معلش سؤال. Do we need the book for the homework to answer the multiple choice questions?
Actually, يعني الكتاب الحقيقة مفيد إن أنت عايز معلومة زيادة، لأن basically if you read the book, you'll find the explanations that I was saying, basically. So some of the things that I talked about today, for example, the HEPA, the items in the HEPA, I just mentioned topics, mentioned like the titles, okay? If you forgot what these titles are, basically you have to go back and look at the book, okay? And the book is very easy to read, by the way. It's not complicated or anything like that. So basically start from the lecture, okay? But if you find something that wasn't clear in the lecture, you can look it up, you find the details in the textbook, okay?
Okay, thank you.
The textbook actually is basically, it's just the first 2 chapters, basically. It's the first 2 chapters. It's basically not the whole book, okay? I chose one of the chapters, one of the later chapters, because actually it goes into details of different aspects of the software. So I chose one of the chapters that is relevant to trying the project. But actually, what we studied was the first 2 chapters. The one about the benefits of EHR, and the one about the standards for EHR. If you have any questions, please try to do things the way you believe would be the easiest for you. And if you still have a problem, next time, please ask me.
Sure,
okay?
Doctor. Thank you.
Okay. Good luck, inshallah. Okay, so I'll see you, inshallah, on Tuesday. Okay? Thank you. Assalamu alaikum.